Now we're going to get into understanding falls risks. And I'm writing a book on Tai Chi for balance now, and part of the build up to that has been a deep dive into the literature of falls risk. One perspective is kind of grim. I want to start with the statement I made earlier. Falls are not an inevitable result of aging, but the data is what the data is. Falls risk annually in the US, 1 in 3 older adults falls. That's 29 million a year. About 10% of those 3 million go to the ER. Those falls result in 800,000 hospital admissions, 28,000 deaths, and incur medical costs in excess of 50 billion a year. This is a major health issue for older adults. Falling is the #1 cause of injury and death from injury for older adults. In the population in the aggregate, currently the #1 cause of injury is either drug overdose or a car accident. But when you get over 65, that changes. And that starts at about 60. And then at 65, it's clear that the #1 cause of injury and death from injury is falling. 20% of falls cause serious injury. Here's what the literature says happens for those of us that are aiming to head into relatively smooth later time in life. Any of these is a big factor: a broken bone, a concussion, and then broken hips. The data suggests that 90% of broken hips result from falls, and half of the older adults that break their hips never return to functional walking, and 20% of them die within a year. This is not where we want to go. Down hard on the ground unintentionally. Some other consequences of falls out of the scientific literature. Falling is clearly associated with a loss of independence. 40% of assisted living admissions from previously independent adults are associated with falling. And then there's other consequences besides the injury. And people get out less mobility, less activity, less exercise, less social contact, and then psychological consequences, low mood, both from falling and the consequences of falling. And then fear and anxiety. I mean, there's a syndrome, post-fall anxiety syndrome. So there's a lot of consequences to going down hard on the ground that I want all of you to avoid. Risk factors there's a lot of reasons people fall, but there's some really big reasons. The #1 is loss of leg and hip strength. To maintain stability, to recover from a perturbation takes muscular activation and the movement that muscles can generate. When you're weaker, you can do that less. If there's one thing you can do to contribute to reducing your risk of falls, it's to exercise and make your legs and hips stronger. I want to highlight a few other things. That if a person's fallen once, then the risk of fall increases about 3 times. If you've fallen, you would say, hey, I need to decrease this risk because it's just gone up. Gender is associated with a higher risk of falls, particularly injury falls. Women are 2 times as more likely to go to the hospital because of falls. Part of that might be due to more brittle bones from osteoporosis, and with a fall that otherwise would not cause a fracture, causing a fracture. As we age-related conditions or chronic conditions also result in multiple medications, and there's a significant increase in fall risk for those that are taking more than 4 medications. If you see any of this in your profile, I would not worry about it. I would just see that as extra motivation to take advantage of the interventions that reduce falls risk. So that sounds like a lot of bad news. People falling, hurting themselves, going to nursing homes. That's not the way we want to age. But there's good news. This is what I want to emphasize. Falls are not an inevitable result of aging. Prevention, intervention reduce falls. And the CDC puts that out because the science strongly supports it. We'll get into that in a minute. And what does the CDC say about prevention interventions, things to do to reduce falls? Here's what they say. Exercise and make your legs strong and improve your balance. Tai Chi is a good example of this. So here we have the government recommending Tai Chi as an exercise for reducing falls. Whether a government recommendation is persuasive or not, different people can feel differently about that, but across all leading medical authorities, including the ones on your screen here, Tai Chi is recommended for falls prevention. Why would the Mayo Clinic or Harvard Medical School or the American College of Sports Medicine encourage older adults to do Tai Chi so they don't fall? It's the science. And on your screen now are just titles from a handful of the extensive medical research into Tai Chi as an intervention for falls prevention. And consistently, researchers are very comfortable saying, hey, the evidence supports Tai Chi as an effective intervention for falls prevention. Just to get a little more flavor for the science, let me go into a particularly important study. This was reported in the Journal of the American Medical Association toward the end of 2018. So here we have a study. This compared Tai Chi with two other types of exercises among older adults at high risk of falling. There were almost 700 people in the study with a mean age of 78. So this is an older group of older adults at higher risk of falling. And then they were randomly assigned to 3 exercise training groups. One was Tai Chi, one was what's called multimodal exercise. That is basically the kind of light resistance training, some aerobic training that you might get at a senior center, combination of exercises. And then one group did only stretching. This was a 6-month intervention, twice a week for an hour. The different classes met. They were led by trainers through the exercise. There were measurements before and then after on falls history and other measures of balance and functional performance that are associated with falls risk. And here's the results. The Tai Chi group at 6 months had experienced significantly fewer falls than the other 2 groups. Almost a third fewer falls than the multimodal exercise group, almost half fewer falls than the stretching group. One takeaway from this research is that with this population, Tai Chi was the most effective exercise program of the 3 tested in reducing falls, keeping people out of the emergency room, preventing injuries, and the grim consequences of those falls. That's where I want to leave falls risk. All of you that showed up today and all of you that listen to this will not be in the group that does not understand falls risk. Unfortunately, many older adults don't. So here's the big point. Falls are a serious health risk for us as we age. Greater than smoking, greater than car accidents, greater than violence. Falling hurts more older adults than anything, on one hand. On the other hand, they're preventable. And one key intervention for preventing falls is exercise. And the #1 recommended exercise for fall prevention is Tai Chi.